Hey, so today I'm going to be talking about the cardiac bypass surgery, also commonly called as the CABG or the CABG surgery. The topics that I'm going to cover today are: what is CABG surgery, for who is this procedure advised, what are the types of the CABG surgery, how is this procedure performed, what is the recovery period after a CABG surgery, how to select the best surgeon and hospital for this CABG surgery, and what is the cost of CABG surgery in India. Coronary artery bypass procedure is a surgery in which an artery or a vein from the hand, leg or the chest is taken and the harvested graft is put on the heart to bypass a narrowed vessel. This is usually done for patients in whom the angina is very severe, not responding to medications, and there is severe stenosis of the coronary arteries. This is usually advised for patients beyond a certain age in which the angioplasty has not given a desired result. This procedure is basically rerouting the blood flow to a part of the heart which is not getting a normal blood flow because of the stenosis or the atherosclerosis of the coronary arteries. So this restores the blood to the heart muscles. Now, when is a CABG surgery advised, or who are the good candidates for the CABG surgery? There are 5 main indications. First is angina not responding to conventional medication. Second, when there is severe stenosis of the left main coronary artery. Third, when there is severe stenosis of the other smaller arteries. Fourth, when the angioplasty that has been done before has failed and the arteries have again re-stenosed. And fifth, immediately after a heart attack, to salvage on the remaining heart muscles. These are the 5 main indications for a CABG surgery. How is a cardiac bypass surgery performed? The surgery is usually performed under general anesthesia. It takes about 4 to 5 hours. The sternum is divided and the heart is exposed. The number of grafts that are required are predetermined with the help of the investigations done before. The grafts are prepared and they are implanted on the stenosed vessels. One part of the vessel, that is from the graft, goes into the aorta to maintain a proper blood supply. During the procedure, the heart is put on a heart-lung machine and stopped by hypothermia. After the procedure, the heart-lung machine is taken off, the patient's heartbeat is started and the sternum is closed. This is generally the traditional way of performing a cardiac bypass surgery. How does the recovery typically look after a cardiac bypass surgery? Patients are usually shifted to a surgical cardiac care ICU for 1 or 2 days following the procedure. Most of the patients do well during the ICU period. They are shifted into normal rooms after the 2 days. Routine normal walking, foods and daily activities are started in next 3 to 4 days. Some medicines are advised basically to control the pain, to avoid any kind of blood clotting, and antibiotics for the healing of the wound, incision wound. This is how typically the immediate post-op recovery period looks like. After that, the patients can resume most of the normal activities in 6 to 8 weeks following the surgery procedure. What are the types of cardiac bypass surgeries? Basically, there are 3 types of procedures. First is the open heart surgery, in which the incision is of big size through the sternum. Second is the minimal invasive cardiac surgery, in which the incision of the smaller size and the approach to the heart is through a scope, which gives the complete visualization of the heart to the surgeon. The latest advent now is the option 3, which is the robotic surgery, in which a robot assists the surgeon for the cardiac bypass. This is somehow considered to be better than the other 2 techniques and is usually now advised by most of the surgeons in India. What technique will be best for you is determined on the number of vessels that are affected. So it is important to determine this first, and all patients cannot be suggested robotic surgery. It would be important to understand this. What are the results seen after a heart bypass surgery? Firstly, the angina is relieved. The common complaint of the chest pain, that is subsided. Secondly, once the re-stenosed vessels are open, the energy levels of the patients start increasing and they are able to do a lot of activities. The symptom of breathlessness also comes under control. It is important to understand that most patients will be symptom-free for at least 10 to 15 years following the procedure, but the underlying coronary artery disease still needs to be controlled by your diet and lifestyle modification. You will need to avoid sugar and high-fat diet, you will need to have a decent exercise regime, and you will need to avoid alcohol and smoking. These still need to be done after the bypass surgery and are very important. How do you select the surgeon and the hospital for your cardiac bypass surgery? While selecting a surgeon, make sure you check the expertise, certification and the experience of the surgeon. Please check that for how many years has the surgeon been operating as a cardiac surgeon, what is the number of patients that he's operated. Preferably if you can get a reference also. While choosing a hospital, please check the brand value of the hospital, check for their infrastructure and the support services, and how is their paramedical staff trained to handle cardiac cases. These are very important when you go for your bypass surgery. Specifically, I would also suggest check for the anesthetist who would be involved in your cardiac bypass surgery, because the anesthetic experience in cardiac cases is of utmost importance. What is the cost of cardiac bypass surgery in India? The cost is usually in the range of $5,000 to $7,500 depending on the type of surgery that is advised for you, whether it's open, minimal invasive or robotic cardiac surgery. This cost will usually include a 6 to 8 days of hospital stay. The other factors that could influence the cost is if there is use of any extra consumable like a IA/BP balloon during the surgery, management of any complication or any prolonged stay. Such factors can also influence the cost. I hope you are satisfied with the information that we have provided you with the cardiac bypass surgery. If you or any of your loved ones is looking for this surgery, please feel free to connect with us. We have managed almost 2,500 cases in last 20 years and will be very glad to help you also. Thank you.